Hi, I'm Dr. Rod Kurthy. I'm the developer of the KöR Whitening system. I'm going to go over with you all the details you need to know for your whitening at home. But I'd still like to have you read those instructions that came with your kit. They're very important and they'll answer a lot of your questions. The first thing to remember is to always keep your whitening gel syringes in the refrigerator. Now, every night when you're going to bleach, you're going to wait until bedtime. Now, that doesn't mean that you can put your whitening trays in your mouth and sit and watch television or read a book. You have to be ready to actually go to sleep. Now, what you want to do is you want to brush your teeth first and ideally floss. And then the next thing you're going to do is apply your desensitizer. Now, you're going to apply the desensitizer only the first 2 nights. You will also apply it each morning, but in the beginning, just night 1 and night 2. Okay, now that you've brushed your teeth, the next thing to do is to apply the desensitizer. Take one of the swabs from your kit and the desensitizer. Add drops of the desensitizer to the swab until you can see that it's thoroughly moist. Madison, here you go.
Thank you.
Now Madison's going to show you how to apply this. As you can see, she's applying force on the outer surfaces of the teeth with emphasis near the gum line. Then what she's going to do is apply it right on the edge of the biting surfaces of the front teeth, both top teeth and bottom teeth. Now, as you're doing this throughout the mouth, whenever you feel you need to re-wet the swab, you'll just add more drops to that as needed. Now, let's pretend that Madison has applied this to all of her teeth, top and bottom. Notice how she's keeping her lips away from the teeth as best she can. She's going to do that for about 30 seconds. After that, she'll rinse out with water. Next, we're going to fill the whitening trays. Remove them from your case. Notice how flexible the trays are. You'll remove the cap from the end of the whitening gel. Now let's go over the technique of filling your trays with the gel. Notice that I'm not going to put any whitening gel in the last tooth here. I'm going to start on what's called your first molar. Now the bicuspid, the cuspid. The larger the tooth is, the more whitening gel you need to place. And notice how I'm placing it only on the outer side. This is what it should look like when you're done. Next, let's look at the lower tray. Again, I start on the molar, I go to the bicuspid and the cuspid tooth. Now on the smaller lower front teeth, you're going to be using less gel than you did on the upper. That is what it will look like when you're finished filling the lower tray. Okay, we filled the whitening trays with the gel, but remember the gel was in the refrigerator before you placed them in the tray. So the gel is a little bit cold. If you are one of those people that has sensitive teeth, what you might want to do is fill your trays before you brush. Now, remember that these trays are flexible. When I place these trays in Madison's mouth, the thick gel is going to push the tray away from the teeth. That's not good. So what you need to do is you're going to have to push this back against the gums. And I'm going to show you that. Okay, let's place this on the teeth. Be sure that you push this all the way up. And notice, as I mentioned before, how the thick gel is pushing the tray away from the teeth a little bit. So what you must do, this is very, very important, gently push it back. And please notice that as I push this back, a little bit of gel is just peeking out over the edge. That's very important. If you don't put enough gel in and you don't see it peeking out over the edge, you will not create a seal against saliva and you will have a problem and not get as white. And then just wipe off any excess that you have there. And then, of course, insert the lower one after that. Go ahead, Madison, close. Good. When you wake up in the morning, take your trays out and rinse your mouth, brush your teeth, and then you can clean your trays. Clean them by running them under cool water. Use a cotton tip swab to clean them in the water, but be sure not to use the cotton tip swab that comes with your bleaching kit. That is meant to only use with desensitizer. After you've thoroughly cleaned your trays, shake the water off and place them back in your tray case. Every morning after you brush your teeth, be sure and use the desensitizer on your teeth in the same way that we showed you before. During your whitening, you want to avoid staining foods. A good food to avoid is anything that would leave a permanent stain on a white coat like the one I'm wearing. After you're finished with your whitening, you can go back to your normal diet as long as you're maintaining. Now you're putting forth a lot of effort to get your teeth white. Very, very important to keep that whiteness your entire lifetime. The way to do that is with the KöR Whitening gels. Your dentist will be able to supply you with that. And your dentist will go over a suggested maintenance routine to follow at home. Most often we like to see people wearing their whitening trays, maybe once a month or so. If possible, don't skip nights when you're whitening at home. The result is much better if you whiten every night consecutively. If you have a problem at all, please call your dentist and let your dentist know. I'm sure you're going to be thrilled with your whitening results. You could not have selected a better method.